Hi, Facebook friends and Facebook followers. I'm Dr. Oscar Aguilar, and as we had posted, we're doing the live session, and today's topic that we're going to be discussing is going to be hormone replacement therapy. And this is going to be both male and females. However, it seems like for whatever reason, females are more interested usually on this kind of topic. So I'm going to be talking more about females, and feel free to send your questions, of course, regarding bioidentical hormone replacement therapy or hormone replacement therapy in general. And then at the end, I'll be saying something about men and hormone replacement therapy. So most of the times I hear questions about, is hormone replacement therapy needed? And the answer is, it's only needed for those people that are low on hormones, and and we measure those. So definitely it's not something that we just want to go ahead and use at all. Now, the other question is it safe to use hormones? And the answer is, in the case of bioidentical hormone replacement therapy, it is absolutely very safe. And I'm going to go over some of the data supporting that, and perhaps try to clear a little bit the confusion out there. So the question is this. So why do we need hormone replacement therapy now, and we did not need it in the past, or at least seems like we did not need it in the past? Well, that's the first wrong kind of information. Hormone replacement therapy has been around for 40, 50 years. Bioidentical for about the same time. And the problem comes in here, which is a good problem to have. Females, about 100 years ago, were not living more than 50 or 55 years. If they were lucky, probably 60 years of age. If you take into consideration that menopause started like around 50 or 55 years of age, that means that women did not have a lot of time to live, and therefore, spending a few years without hormones was not the end of the world. Now the life expectancy of a female is even longer than a man. It's in the range of 80, 84, 89 in some other countries. And the question comes, if menopause comes sooner than before, let's say 45, 49, 50, 52 or so, is it fair for them to spend all these years without hormones? The answer clearly is no, because hormones are needed for multiple reasons in the body. Number one, in females specifically, hormones are very important for memory, sleeping well, energy, a lot of the functions of the body. In fact, if they are low on estrogen or estradiol, it seems like they're more prone to develop diabetes. They feel tired. They have a lot of heartburns, hot flushes, all of these symptoms, lack of energy, that are very, very common, and I see every day in my clinic. So spending another 20, 25, 30, 35 years with these symptoms is not good for them. It is unfair for them. And the most important thing, that they're going to develop higher chances of developing diabetes, bone fractures, and so forth. A very common question is why they have a lack or very low libido or sex appetite. And the answer is the same, because the hormones are very low. And it is important to mention that even though we always talk about menopause, there is a condition that we call pre-menopause or peri-menopause, which can take 7, 8, 10 years prior for the patient to develop a full-blown menopause. However, in those years, which is quite a long time, they already have a lot of the symptoms of menopause, and they do not really know why they are gaining weight. It's difficult to lose weight. They're developing a little bit of joint pains, back pain, tiredness, fatigue, sleeping poorly, poor memory, etc. And they don't realize that is perimenopause or hormone imbalance. Now, So how do we use hormones? Well, hormones are used in many ways. They come in pills, they come in creams, they come in patches, they come in implants, and then come in pellets, which is another kind of implant. And all of those have just differences, advantages, disadvantages, and so. When it comes to hormones, we talk about synthetics, which means that they're made in the lab, or that they're taken from plants, which is bioidenticals. So synthetics and bioidenticals, very, very much of a difference between them. Synthetics, for the most part, even though they have shown to be safe, we, in my clinic at Texas Integrative Medicine and Cardiology, we do not use them in general. There were studies and data that comes from the 70s, the 80s, and later on the 90s that suggested that hormones could cause cancer. However, that was traced and linked to a specific hormone called progestin, which we no longer use. Even the synthetics that I do not believe is the best avenue, though, are safe, and they do not cause cancer. They do not cause breast cancer specifically at all. There are multiple studies supporting this. However, in my clinic, as I said, we use bioidenticals. Bioidenticals means that we extract them from plants. They're, of course, processed, and then we have creams and we have pellets. Pellets are like tiny little rice, very, very small. The length is about 3 to 4 millimeters, and the width is about 0.5 millimeter. And in the case of females, we usually insert one of those or 1.5 in the area of the butt, meaning the buttock, and the activity goes for 4 months. It starts eluting or dissolving slowly and is giving hormones to the females. The effects are pretty much dramatic, and they usually appear around a week to 10 days later. They last for 4 months, at which time we have to do another pellet insertion. In the case of creams, they add the creams on a daily basis, and the effect starts kicking in or appearing after about 7 or 8 weeks. That's a little bit longer, but they're definitely very beneficial. We follow the levels. We can follow the levels in blood or saliva by different testing, and make sure that we are adjusting the dosage as needed, because the dosage at the beginning may not be completely clear. We always do that by using a computer system that allows us to know how much to use, but we adjust as we go depending on the results later on in 6, 8 weeks, and so forth. When it gets to the point of being stable, we don't measure them again. We just keep dosing up accordingly every 4 months or so. Again, they're very safe, and the results, for the most part, perhaps in the range of 90% of our patients, are dramatic. Everybody becomes happier. They feel more energy. They feel healthier. They feel younger. And they go back to, let's say, when they were feeling in their 25s, 30s, 35 years of age, depending on the case. So we are advocates of hormone replacement therapy all the way. Remember, females are going to spend another easily 25, 30, maybe 40 years of their life in menopause. So spending the time without hormones has shown to increase the chances of developing bone problems, heart problems, and many other problems in general. And the most important one is to lower quality of life. Therefore, hormone replacement therapy, specifically speaking about it, bioidentical hormone replacement therapy, is going to improve those symptoms and is going to have a better life. In females, we also talked about testosterone. Testosterone, even though is a male hormone, females need some of that. Very, very commonly, we see females with low testosterone, and we always supply, when needed, with testosterone. Testosterone improves significantly the bone density, prevents fractures, prevents osteopenia and osteoporosis, which females fear a lot. And importantly, also increases the libido. So it has multiple beneficial effects that we, are looking for in our patients to feel better, look better, and be healthier. Now, in the case of metabolic problems, when we use hormones, we see that it's easier for females to feel like they want to do activity, not only sexual activity, but exercise. The other one is it's easier for them to lose weight, to lose mostly fat, and increase the muscle mass. In fact, those are measurements that we follow very closely in our clinic to make sure our patients are going that way. When it comes to males, it is very common to see low testosterone. In general, and as a rule of thumb, any male that has a little belly, any male that is overweight, any male that is beyond, with these characteristics, that is beyond 40 years of age, even sometimes 35, especially if they have sleep apnea, if they smoke, invariably they have low testosterone. And the symptoms of low testosterone for a male are similar to the ones that for females. They feel tired, fatigue, lack of libido, sex appetite is very low, but also the sexual potency decreases quite a bit. The erections are not as good as they used to be. And, it's not uncommon to have the wives complaining about it more than the guys, more than the gentlemen. So in the case of men, we also advocate the use of testosterone. And similarly, we have pellets that we insert. We have injections that they go in the muscle, and we have creams. Creams take a little bit longer to work or start working, let's say 6 to 8 weeks. In the case of the intramuscular injections, they're like pretty much next day. And the pellets take about 7 to 10 days to start working. The advantage of the pellets is that they last 6 months, and we don't need to do another injection for that amount of time, so every 6 months. The ones that go into the muscle, unfortunately, are given once or twice a week, and the creams need to be applied every day. Testosterone does not cause prostate cancer at all. It's very safe, and we use it even in those patients with large prostates without causing any problems, any cancers, or anything like that. So again, hormone replacement therapy is recommended for those males or female patients that require it, that they have symptoms and that their levels are low. Checking the levels is very simple. It can be done in blood originally, or the baseline, we do it in blood, and they can be followed later on in saliva. So either way, we always like to know exactly what's the amount of testosterone, estrogen, estradiol, progesterone, estrone, estriol, and many other hormones. And we check those routinely, and we supplement them whenever they're needed. Another important hormone that we seldom talk about, but is huge, is cortisol. Cortisol increases with stress, with too much exercise, with not enough exercise, with smoking, with not sleeping properly. For those patients that are not sleeping enough, cortisol goes up. And the problem with cortisol is huge. Cortisol, if it goes up, it then increases one protein that we have in the body, which binds estrogen, progesterone, and testosterone. Don't let them work properly. So those people with high cortisol are equivalent of having a menopause state or an andropause state, meaning menopause in males, we call it andropause. So measuring cortisol also in blood or saliva is very important to make sure if the patients are in need for that. Cortisol, we usually do not supplement, we do not use. We need to make sure that we correct the underlying problem that is causing the either high cortisol or low cortisol. And just by doing that, it improves. Examples of that would be sleeping better, measuring the amount of exercise, not over exercise, not under exercise. Make sure that their sleep it has good quality, not quantity, but rather they're sleeping okay, they're resting. And then depending on that and correcting those problems, such as also as diabetes, metabolic syndrome, high blood pressure, and so forth, cortisol tends to improve significantly. Once cortisol is under control, it's very common to see that those patients immediately feel better. It is important to remember that the human body is not one organ or two or three or four or any more. It's a conjunction of all of them. So it's a whole system. It's a human body, and we need to see it integratively, to its entirety. If we do not treat everything at the same time, it is very difficult for whatever you're treating to work properly. Therefore, everything needs to be seen and taken care of at the same time. Diet is a very important factor in our hormones. Diet is a very important factor in all of our health in general. Therefore, following a proper diet is important. I personally like the ketogenic diet. I like the paleo diet. But all diets, if you study them, have shown to have benefits, have pros and cons. So diet in general needs to be individualized. We are getting a question coming up in here that says that I heard that female hormones can cause breast cancer. Well, probably somebody logged in later, but the answer is no. Especially bioidentical hormone replacement therapy does not cause breast cancer, does not cause uterine cancer, does not cause cervical cancer, or doesn't cause any cancer whatsoever. In fact, when I have females that have already had breast cancer, let's say 10, 15 years ago or so, I always call the oncologist and make sure that they are on board. And the majority of the times they say that they are okay for those patients to receive bioidentical hormone replacement therapy. So we do, and we monitor those very closely. Okay, so I hope that's very clear. Another question comes in here. If my hormones are low, is that causing my weight gain? Okay, we also mentioned that a little bit. Weight gain is a consequence of multiple things. You can never say one variable is causing this or causing that. Again, we have to take everything together at the same time and treat those things accordingly. Nonetheless, low testosterone, low estrogen, low progesterone indeed can cause weight gain and can make it difficult to lose the weight. The same for cortisol. Cortisol increase can make people gain weight. And you don't have to be, there's a disease by the name of Cushing syndrome where the cortisol is excessively high. They are very, very obese people. So you don't need to be Cushingnoid. In other words, you don't need to be obese to think that you have a high cortisol. Even mild elevations of cortisol can make you gain weight. And again, how do we control cortisol? Just protecting, just correcting the underlying cause of the cortisol elevation. There are multiple causes. I cannot give you a recipe to follow at home. You need to make sure that you go to your physician that is knowledgeable about hormones, measure them, and then go over a very detailed history, physical exam to try to find out the cause and then correct it. Don't forget that sleeping well is very important for the cortisol level. Another question in here. Can too much exercise be hurting my cortisol? Oh man, that's a great question. Yes. People think that losing weight is a matter of exercising a lot. And that cannot be any farther than the truth. Exercising at some point too much may actually hurt your chances of losing weight. That's if you have too much inflammation, too much cortisol, you are decreasing the chances of losing weight. So it is counteractive. Not exercising is not helpful either. So exercising enough is important, and having the amount of resting enough is very, very important. Don't forget about sleep apnea. Don't forget about sleep problems as the cause of high cortisol, as the cause of low testosterone, as a cause of premature menopause, and problems like we have already described. Very, very important. Another question is coming in here, says, what about sugar in the diet? Is it sugar or fat that causes hormone or heart problems? Very smart question coming from Jorge. In the 1970s and early 80s, fat was demonized by a couple of studies that later on were found to be incorrect, and they were like manually changing the data. Once they were found out in here, they also found out that some of those studies were funded by the Sugar Research Foundation. Now we know that, in general, the real demon in the room is sugar. And you have to be very careful with sugar. Sugar comes in the way of sugar like that, but it also comes in a lot of ways. Substitutes with sugar, diet sugars, which are probably worse than sugar itself. It comes in honey, it comes in pasta, flour, rice, potatoes, and so forth. Sugar is the cause, it's actually very well recognized, is the cause of our obesity epidemic. Right now in the United States, we have a 37.8% obesity in the whole country. Approximately 10% of the people in the United States are diabetics. However, there's around 33 million diabetics that have not been diagnosed. Therefore, the numbers for diabetes is even higher than that. But there's a condition by the name of prediabetes, which is huge. It's also called metabolic syndrome. Those people older than 18 years of age in our country, 34 to 35% of them are pre-diabetic. Of those people above 60 years of age, close to 50%, that's half of them, are pre-diabetic. All of these conditions come along with low testosterone, low female hormones, and earlier menopause. So if any one of you listening to us in here is overweight, does too much or too little exercise, doesn't follow a very good diet, your intake of sugar is kind of high, definitely you need to be checked for the hormones. We tend to think about the lack of hormones of those patients older, men above 50 or 60, females above 50 or 60, and that's wrong. In my clinic, we see young people, males at 25, even 28, and so with low testosterone. We also see early menopause in 40-year-old females, sometimes 38, and of course, sometimes at 45, 50, and so forth. So talking about this with your physicians is extremely important. Questions coming in here. Is men erectile dysfunction an indication of low testosterone? Okay, erectile dysfunction or lack of a good erection is multifactorial. There are multiple things that can cause that, multiple. One of those multiple things, yes, could be low testosterone. Testosterone helps with libido and it helps with getting a good erection. However, there are vascular problems, let's say not good blood flow going to the penis, like vessel diseases that can also impede a good penile erection. So you have to be very careful with that. And because if that's the case, that means that this patient has higher chances of having heart vessel disease. So again, just take a look with your physician, make sure that you mention those findings, and make sure that you have proper testing to find out exactly what may be the cause. Nonetheless, yes, testosterone, if it's low, it is a possible cause of erectile dysfunction in men, as well as lack of libido. So just it's important to be on top of those things. Another question here. I exercise a lot and I don't think to grow muscles. Okay. Obviously, this is a question coming from a man and Carlos. And yes, indeed. Um, I see that all the time. On a daily basis, I see those complaints. In general, we try to lift weights and do exercise to try to grow muscles. That's common, and try to lose fat. But if the cortisol is very high, chances are you're not going to get the muscle growth that you want. If your testosterone is low, chances are you're not going to see the growth that you are expecting. So definitely you have to have a baseline blood, saliva testing. Either one is fine to find out your levels of testosterone and the other hormones that I mentioned, to find out if that's the cause of not growing muscle. However, when we have low testosterone, we always think about just getting testosterone shots. Wait, I think the first thing is to make sure that we try to find out the answer why the testosterone is low, and then react on it and use it accordingly. Another question comes in here. They tell me that fat is not healthy, but lately they say that that is okay. Okay, there are two kinds of fats, guys. One that is unsaturated, and another one that is saturated. In general, neither one is bad. However, we try to limit the intake of saturated. Saturated means that it's sort of like a solid when it's on room temperature, sort of like butter, bacon, and all those fats. So we try not to go above 10% of the daily intake. But the other ones, the unsaturated, polyunsaturated, monosaturated, and so forth, are actually very benign. And we on those do not put limits on our patients. They can eat or consume as much as they want. They are good fats, and they help in many, many ways. That would be another topic for another day. Okay, there's another question. If my mom, my sister had breast cancer, supposedly I am in high risk of getting breast cancer, can I use hormones? Okay, first of all, we need to check the levels. If you are postmenopausal, or if you're perimenopausal, premenopausal, or you're not even there, we need to check the symptoms to make sure that we're treating accordingly. But the answer is yes. We always want to make sure that we know your mammogram. We also want to know, possibly, if needed, a breast ultrasound. We do not need to, but we could check your BCR2, which is a marker a genetic marker for breast cancer. But regardless of those, the answer is yes. If you need it, of course, you could use bioidentical hormone replacement therapy, and again, I would definitely be in favor for that. That's a good question. Another question: if I'm taking creams as far as therapy for menopause, can I switch to pellets? The answer is yes, and vice versa. You can go from pellets to creams, and you can go from creams to patches. Doesn't really matter. The most important thing is to make sure the levels, and then depending on the needs, try to find out what's the equivalency, what's the dose that you may need now that you're switching therapies, for another one. So go to your physician, whoever is doing hormone replacement therapy, and go for it. Sounds good. Another question. I have back problems and it's hard for me to exercise. However, I would like to exercise. What would you advise? Okay. A little secret in there that is being studied for multiple decades is what kind of exercise is best. And I think the answer is difficult to be settled. Any exercise helps, but depending on your condition, depending on your back situation, depending on your age, depending on your physical capacity, and so forth, I always say that walking 1 hour a day is a great exercise. I always see my older patients beyond 80, beyond 85, Sometimes those patients, about 78 or so, that come to my clinic in a healthy way, walking, talking, doing their activities on their own, looking pretty good. And invariably, one of the secrets that they share is that they walk 1 hour a day on an almost daily basis. So walking is perfect. More exercise than that, it'll depend on your capacity to do exercise, your desire, and so. Remember, exercise is not really needed to lose weight. It does help. It is additional benefit, but it's not exactly a must. So if you hate exercising, there's ways to get around it. One of those is just by what your food intake is. Okay, any more questions coming up here? I don't see another one. Okay, keep sending your questions, guys. I'll be happy to address those. The amount of time that we have left in here is about...
We have a question.
Oh, there's a question here.
Doctor from Cardiology. It says, Doctor, can low testosterone or hormone imbalance be a cause of lack of mental clarity and low motivation in your 30s and 40s?
That's a very important question. I'm going to repeat it. Can low testosterone cause low mental acuity? In other words, confusion, lack of memory, and so. You bet. Let's talk about males. Lack of testosterone indeed causes all of those and way more than those. A lot of times I see my male patients come in here tired. They have a hard time waking up. They have a hard time getting out of bed in the morning. They have joints, aches, pains, and pretty much just feel tired, like they don't want to do anything. It's possible that the main reason for that is just the lack of testosterone. So go ahead, check it out, and make sure that you check it, with someone that is very knowledgeable about testosterone, because the labs ranges are very different from one to another, and you need to make sure that you know and understand what the levels mean. In the case of females, that's another very common complaint. I feel tired. Seems like my memory is not very good anymore. My focus is not very clear. I do not sleep well. I wake up a lot. That's very, very common symptom of low estrogen, mainly progesterone, and to some extent testosterone. So females tend to be a little bit more complex, and we have to look into more hormones than males. That's always been the case when it comes to medicine between males and females. So once the numbers are checked and once the values are analyzed, symptoms are asked and understood, then therapy can be started. Again, creams, pellets, implants, you name it. I think I'm a strong advocate of that. One of the things about testosterone is that it doesn't increase the weight. It increases the muscle mass. It decreases fat mass. That is, if you use properly. So those are changes that I want to see in my patients, because those changes improve life. Those changes improve symptoms. Those changes are health, and those changes make your life better. I think at the end of the road, all of us want to be happy, feel great, do whatever we want, enjoy life, see our families being happy. And, that's a very common goal. So make sure that if you have symptoms like the ones that we mentioned, or if you're a female and you're approaching that age of menopause, have your levels checked and understand what they are so you can treat them accordingly. Another important thing is, don't forget the microbiota health. Microbiota, as I said a month ago or so, it's 100 trillion bacteria, parasites, fungi, and viruses that we have in our gut, that they make a difference for health, mental acuity, sleeping well, craving, mood changes, energy, and in general, health as a whole. In our clinic, Texas Integrative Medicine and Cardiology, that's one of the first things that we are going to check, your microbiota health, and then based on that, decide, depends on your needs, what's going to be recommended. But a very healthy diet is the way to get started for anything that comes to health. Are there any questions out there? No? We're going to finish in here. Thank you very much for your attention, guys. Have a wonderful, wonderful day. Don't forget, our phone number is 915-600-2905. That's our clinic. You can also look us up in our webpage, timcelp.com. Obviously, Facebook. CardioRx is one of the products that we created. It is here for you, and you can have all that information in cardiorx.com. We also partner with them, and we partner with NOSH, N-O-S-H, for a healthy nutrition. When it comes to health, you have to put everything together. You cannot hang your hat in one variable, two variables. You need to take the whole 5 variables together. One of those being nutrition. Make sure that you have a good nutrition. That way you don't have to diet. NOSH. Have a wonderful day.